Hi everyone, I am Dr. AKP. Have you ever looked at someone's eye and noticed an angry stare, a droopy eyelid, or a puffy swelling in the morning? Your eyelids can reveal far more than you think, from thyroid disease to kidney problems. From nerve weakness to high cholesterol. The story often begins right here, around your eyes. In this video, we'll explore the hidden meanings behind common eyelid changes, simple signs that can point to a serious condition. Let's decode them one by one. At first, I'm going to read you the lid retraction or staring look. Look at this patient's condition. This is known as staring eye. Look, this patient's white area above this iris is visible. In a normal person, like in this picture, we cannot visualize the white area above the iris or or this black region. That means this wide open eye with this anxious expression is the root cause of something. What is the cause? This is a thyroid disorder condition. This is known as Graves' disease, and this condition is known as lid retraction. Your thyroid overactivity causing swelling behind these eye tissues, the fat and other soft tissues normally swells up and causing your eyes to protrude beyond the eye socket. And this causes this kind of look. Next is ptosis. Look at this kid's both eyes. One of this eye is drooped down. When we compare to this eye, this drooping eyelid is because of there is the nerve which is not functioning properly, or there is any muscle that is not functioning properly. There are some common causes such as third nerve palsy. This is oculomotor nerve palsy that supplies the muscles of your eyes. This could be Horner syndrome. This is a sympathetic plexus problem. And the third condition is myasthenia gravis, where your muscle become weak due to any antibody produced against the muscles. So when you have any kind of ptosis or drooping eyelid, you must seek your doctor's advice and diagnose if there is any cause behind it. Look at this picture. This is Horner syndrome. Here we have the eyelids droop behind the normal position, and the pupil is normally constricted, and the eyes is red. And there is also lack of sweating, which is also known as anhidrosis. This is a constellation symptoms for Horner syndrome. Next, we have puffy eyelid. When you wake up at the morning and you notice your eyelids are swelled like this is glistening appearance, and this is because you have any nephrotic syndrome or you have hypothyroidism, which is again a disorder of your thyroid gland where your thyroid is not making much hormone and a fluid builds up around your eyes. And you must remember, if you have this kind of condition, and you must seek the doctor's advice, because hypothyroidism can lead to several metabolic syndrome, and if you develop nephrotic syndrome, that could lead multiple complications which would you can suffer from you can suffer from a lot of complications. And next, dark circle around the eyes. Look at this picture. This kid has dark circles, and we know dark circles are mainly due to lack of sleep, but there are also some conditions that lead to this kind of dark circle. First of all, there is anemia, when your blood cells get below your normal level, and chronic fatigue also. This is the most common cause we all know, and this is sinus condition. We have multiple ear sinuses in our skull, and when this sinus gets gets built up within fluid instead of air, it is called sinusitis, where when there is associated inflammation. And also allergy causes allergic shyness. This condition is also known as allergic shyness because there is pulling of venous stasis, which looks darker around the eye skin, and we get dark circle. So you need to be treated for anemia, chronic fatigue, and sinus condition and allergy. Next, we have blepharospasm. Look at this lady's eyes. This left eye is constantly blinking. Why is this eye is twitching or blinking? Because she might have irritation, or this is due to stress. In most person, this eye blinking is also called as blepharospasm, is mostly due to stress. So stress, when your eye muscles got irritated, or it is sometimes due to the nerve irritation. Okay, it is usually simple, but if it persists more than weeks, you must seek your doctor for special advices. This condition is known as legophthalmos. Look at this picture. This person, when she try to close her eyes, one eye is still open, and we can see this sclera here. The sclera is not completely closed here, and if this person uh, remain in this position for the whole night, the eye can get dry. So you must put a sticker, or you must put any patch or artificial tear, so that your sclera cannot get ulcerated, or you may lose your vision, or it can be very painful. So why this condition occurs? This is due to facial nerve palsy. The facial nerve, or the seventh nerve of our cranial nerve, it supplies all of the muscles around our face. So there is one nerve here, another nerve here. So if your facial nerve get weak, or facial nerve become um, palsy, facial nerve become weak completely, so you cannot close your eyes, because this side of this eye muscles got supplied by the facial nerve, and this leg of thalamus or incomplete eye closure happens. Next, we have swollen on tender eyelid. There is painful red lump in the eyelid, and this condition is known as stya, and this condition is known as chalazion. So what is chalazion and stya? When your hair follicle around the eyelid gets blocked, this is known as stya. This is very painful and very sensitive to touch and light. And there is also some whale gland. These whale glands keep the eye moisture, and if it get blocked, you develop chalazion. This is also defined by swelling, blurry vision, and a hard lump, but this is less painful than stya. In both conditions, you need to there is risk of get infected, and this the eyes can get cellulitis, so you need antibiotics. So you must seek your doctor or local primary care. Next condition is xanthelasma, which is known as yellow patches around the eyelid. So I have a teacher in my high school who has this kind of condition, and when I asked him about his condition, he just said me this is because he has spectacles 24/7 on his eyes. So he developed this kind of rash, or whatever you say. But later he developed cholesterol, diabetes mellitus, hypertension after many years. So this could be a prognostic, or a future telling sign that you may have hypercholesterol level, and this is known as xanthelasma. You must check your blood lipids and the other factors that may cause it. You may also get cardiovascular diseases and might get a heart attack. So your eyes don't lie, they tell stories about your internal health. Next time you look in the mirror, look closely. Your eyelids might be speaking to you, and subscribe for the next episode. I am Dr. AKP.